Hello and welcome to this explainer. I am so incredibly glad you're here today because we're going to walk through something really important together. Your personal roadmap to a smooth, successful recovery with the Microspine team. If you're getting ready for spine surgery with Dr. T, you probably have a ton of questions, maybe a few nerves, and you just want to do everything exactly right. Well, take a deep breath. We've completely got you covered. This whole thing is designed to give you total clarity and peace of mind. So, let's dive right in.
Okay, here is our quick agenda for today. We'll start with your pre-surgery countdown, then move into managing medications and pain. From there, we'll talk about protecting your incision, go over the braces and activity rules, and finally wrap up with exercises for your recovery.
Let's start with Section 1, your pre-surgery countdown. You know, a really successful recovery doesn't just magically happen after you wake up from anesthesia. It actually starts right now. Looking at this timeline, you've got a surprising amount of power over your own healing. First up, at least 4 weeks before surgery, you absolutely must quit smoking. This is critical, especially if you're having a fusion, because smoking literally works against bone healing. Then, 7 days out, you need to completely stop any blood thinners, aspirin, and all NSAIDs. Yep, that includes your everyday over-the-counter stuff like ibuprofen, Motrin, Aleve, and naproxen. That's strictly for your safety during the procedure. The night before, total fast after midnight, nothing to eat or drink. And finally, the morning of, you're going to shower using Hibiclin soap. You can usually grab it at a local pharmacy, and it just makes sure your skin is as clean as humanly possible.
Beyond the physical prep, there are a couple of logistical things to check off. Make sure you've secured a responsible adult driver for your discharge, because there's no way you can drive yourself home. And as for your medical brace, don't even worry about tracking one down. The brace company will automatically contact you directly to set all that up.
Moving right along to Section 2, managing medications and pain. Waking up from a procedure can feel a little daunting, but Dr. T has a comprehensive plan to keep you comfortable. You're going to get a full post-op prescription arsenal sent over. You'll have antibiotics and a steroid pack, and listen to me closely on this one. You absolutely must finish both of those entirely. Don't just stop taking them because you suddenly feel better, okay? You'll also get anti-nausea medication, muscle spasm relief, your primary pain medication, and a stool softener to combat the side effects of those pain meds.
Now, I want you to remember the number 4. If your pain is hovering around a 4 or less on a 10-point scale, honestly, plain old Tylenol might be completely sufficient for you. It's highly recommended to stick to Tylenol when the pain is manageable because, unlike the heavy-duty narcotics, it won't cause constipation. And trust me, that's one of the most common post-op discomforts you definitely want to avoid.
Oh, and never underestimate the power of cold therapy. You'll want to apply ice over your incision very, very often. It's such a simple, incredibly effective way to knock down that swelling, lower the inflammation, and get some natural numbing relief right at the source.
All right, let's transition to Section 3, protecting your incision.
Wound care honestly sounds way more intimidating than it actually is. Dr. T has this fantastic, simple rule. No need to change dressing until you see Dr. T 2 weeks after surgery. You heard that right. You literally just leave it alone. You'll have a clear plastic covering called a tegaderm over your incision. Your only job is to inspect it daily. If the gauze underneath stays clean and dry, you are golden. You only need to call the office if that gauze becomes wet or soiled. Otherwise, just let your body do its thing.
So the obvious question is, how do you get clean without ruining the dressing? Enter the Saran Wrap shower. Submerging your incision in bathtubs or pools is absolutely off limits. But for a regular shower, just follow these 3 easy steps. 1. Cover the incision area with Saran Wrap as a waterproof shield. 2. Take your shower. 3. Carefully remove the wrap, gently towel dry the surrounding area, and inspect the dressing to ensure that gauze is still totally clean and dry.
Okay, you know how to prep, you know how to manage your pain, and you know how to keep your incision dry. But here is the million-dollar question. How will you safely move after your procedure? Moving correctly is completely vital to protecting all the amazing work Dr. T just did.
Which brings us right into Section 4, braces and activity rules.
Now, the rules here are extremely specific depending on your procedure, so let's make sure there is zero confusion. If you had cervical, meaning neck surgery, you need to wear your neck brace the majority of the time. But you do get some flexibility. You can take it off for eating, sleeping, and for short breaks during the day. On the flip side, if you had lumbar, meaning lower back surgery, the rules are totally different. You wear that back brace only when you are upright. Do not, under any circumstances, wear your lumbar brace in bed.
Next up are your post-op activity restrictions, and these timelines are really non-negotiable for a safe recovery.
First, absolutely no driving for the first 2 weeks. That's mainly because your post-op pain meds are going to seriously impair your reflexes. Second, no heavy lifting, meaning nothing over 15 pounds for the first 4 weeks. And finally, no high-impact sports or heavy physical activity for the first 6 weeks. Your spine is actively fusing and healing. You really have to give it the time it needs. Here's an incredibly important daily habit for pretty much everyone. You need to change your physical position roughly every 90 minutes while you're awake. Just gently alternate between lying down, sitting, and walking. Prolonged sitting is especially hard on your post-lumbar surgery because it puts undue stress right on that healing lower spine. Keep your body shifting. Let's move into our final stretch, Section 5, Exercises for your recovery. If you're a cervical surgery patient, listen up. You might feel some serious stretching pain right between your shoulder blades or in the back of your neck. Please don't panic. This is completely normal, and it just comes from the muscles stretching during the procedure. Dr. T recommends tackling this with your prescribed muscle relaxants, alternating heat or cold compresses, trying a really light massage, and doing some gentle shoulder shrug stretches.
But while you're doing those shoulder stretches, you absolutely must remember this critical cervical rule. For the first 4 weeks, no constant looking up or down. You've got to keep your head in a nice, neutral position. And definitely no tilting your head sideways like trying to touch your ear to your shoulder. That motion pulls directly on the exact spot that's trying to heal.
Now, for my lumbar surgery patients, your holy grail exercise is the ankle pump. Here's exactly how you do it. First, flex your ankles back towards you and count to 10. Second, extend them forward, pushing down like you're stepping on a gas pedal, and count to 10. Third, just alternate those movements for 10 full rounds, and you want to do this every single hour that you are awake. So why are we doing all these ankle pumps? Well, Dr. T explains the fascinating reason behind it. This will help your nerve to glide and not adhere to the scar. Isn't that wild? By just moving your ankles, you're physically pulling the nerves in your lower body back and forth, ensuring they heal smoothly and don't get trapped by internal scar tissue. It's such a tiny movement, but it has massive benefits. Okay, I know we have covered a whole lot of ground today, but please take comfort in knowing you do not have to memorize all of this right this second. You are going to get a really detailed post-op instruction handout before you even leave the surgical facility. Keep it handy, and if you ever feel unsure about anything, the Microspine team is literally just a phone call away at 602-833-2141. Well, we've reached the end of our explainer. You now hold the entire roadmap to your recovery. You know the prep, the rules, and the exercises. So the only question left to ask yourself is, how will you commit to these daily habits to ensure your healing journey is as flawless as possible? Start planning your routines now, and you are going to do great. Thank you so much for joining me today, and on behalf of the whole Microspine team, we wish you a very safe, comfortable, and incredibly speedy recovery.